Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over a small country that's been newly liberated by the name of Eritrea. Eritrea used to be somewhat, had some wars with Ethiopia and was a part of that. Um, but currently, Eritrea is independent, and it's very important due to the spirit of the people there that they're self-governed. So the Red Sea is along the coastline of Eritrea, and so this is a good maritime place. So the latest social and human development, facility-based births increased from 71% in 2023 to 81%, so 10% increase. Over 61,000 women give birth with professional care. Um, just to give you some, public debt is pretty high at 163% of GDP. And there's a lot of stats involved in this, but water, sanitation, hygiene, wash, 94% are open defecation free, a dramatic improvement from 32% in 2015. So, just in summary, and the political system, and then I'm going to go into the public health portion of this, is that there is a strong state control and limited political pluralism, and hopefully that will change. Modest economic growth that's driven mainly by mining, high public debt, and weak institutional performance. Notable social progress in health, education, gender equality, and sanitation, and then strategic regional importance despite limited global integration. So then I was looking at some of the public health matters, and so the Sustainable Development Goal people are administered there. Some of them were talking about this, and these three individuals are obviously residents of Eritrea, and so this is why this picture was there. Um, so the health system of Eritrea is coordinated and built on free or heavily subsidized care across 6 regions and 58 subzones. So the WHO's 2025 joint external evaluation highlights that free healthcare at all levels and strong community engagement, including community health workers and barefoot doctors, form the backbone of service delivery. So even though there's not all modernized healthcare systems, there's actually ways that you can um, kind of circumvent some of these issues. Health facilities increased from 93 in 1991 to 347 in 2023. 70% of the population now lives 5 kilometers of functioning health facility. And one of the problems is that a lot of healthcare in other countries, that a lot of the healthcare they're living long place, they're living away, far away from where the healthcare professionals are, so they don't get adequate care. And so maybe in the rural places it's not as good, but especially in the urban places, people are getting their care. Under five mortality dropped from 153 1,000 in 1990 to 37 per 1,000. Um, Community-based health delivery, barefoot doctors and community health workers extend services to remote areas, what I was talking about, sometimes traveling by camel to reach at least 20% of the population. This also strengthens surveillance and health promotion. Women's rights: 94% of the villages have abandoned female genital mutilation, up from 32% in 2015. It's a really, really good political situation and public health situation. Um, and then the female genital mutilation prevalence for girls under 5 is 2.3%. Should be 0%, but unfortunately they're still there. Um, so these are some of the areas. I think this is one of the countries where there have been improvements, depending on the source. In that maternal health is increased, child health is increased, It used to be under five mortality used to be 76%. Um, since down 76% since 1990. So a lot of people have been immunized. Infrastructure is better. Women's rights are better. The wash is better. 94% of villages open. Defecation is gone, and then health security with surveillance and monitoring. So the model here is kind of like what sustainable development goals we're looking at is universal access, community engagement, and self-reliance. That's the theme and the motivation of this country. I'm going to quickly go over this article. This was um, somebody, UN representative, providing blogs about Eritrea. Um, 1 year can make an enormous difference. Having completed a year in the role of United Nations resident and humanitarian coordinator in Eritrea, this individual reflects on the complex context of the country and the unique position of the UN to partner. So every day is a learning day for her. My favorite part of this experience has been the learning curve. In the past year, I've learned not just about this beautiful country, but about our own work. They're even looking at solar energy. The guiding philosophy is self reliance, like I was telling you about. Right now, they have a small team, 9 resident agencies. Um, Climate is also a priority. Um, this area is being rapidly deforested. Deforestation is being reversed by rapid reforestation, where the entire country comes together, including students, and planting trees and learn about caring for the planet. Um, Over 900 dams, drought-prone area of the world, they have prioritized conserving water. Um, so they want to make a tangible difference and make a difference on sustainable development goals. Something that they really emphasize is the Barefoot Doctors Initiative, where skilled individuals are sent out into communities that are completely inaccessible. And so that's how they get the rural health going. And so here are some pictures of government officials and the um, UN Council representative. So there's a positive outlook into the future for Eritrea. So that's about it about this country. I think there's a lot going on here, and I think this is a country that is on the right track. I hope this has made some sense. Thank you for listening.